Good morning, everyone, and thank you for joining. I am Alicia Patron-Hauser, registered dietitian and director of food and nutrition services for the San Diego Unified School District. I am very excited to welcome you to this webinar, where we will discuss why school food is one of the healthiest options for most Americans. We are very fortunate to have with us today a distinguished guest who Reuters has named one of the world's most influential scientific minds. Before I introduce the panel, though, let me share a little bit about San Diego Unified's food and nutrition services with you. Our department has a proud history of leadership in school nutrition, ranging from our robust farm to school program to our Love Food Not Waste sustainability program. Our team of approximately 1,000 members serves over 100,000 students every day, offering nutrient-dense meals sourced as directly as possible. These meals include fresh seasonal fruits and vegetables, fresh fluid milk, and even locally sourced meat and meat alternatives. Again, we really appreciate your interest and time today. A couple of housekeeping notes. We are recording this webinar in the event that you miss anything or would like to share later. The link will be provided in follow-up communication. Please feel free to ask questions at any point during the presentation using the Q&A button. We will collect and answer them at the end. And now let me introduce you to the rest of the panel. I am joined this morning by one of our registered dietitians, Melanie Moyer, who will be available for questions specific to our program at the end of the webinar. Melanie is instrumental in our efforts to break school food stereotypes as she plans tasty, relevant, and nutritious meals. Our department is deeply and passionately invested in bringing great food to all San Diego Unified students and engaging you, our stakeholders, in compelling information about school meals. And so without further delay, it is my honor and pleasure to welcome Dr. Dariush Mozaffarian to speak to you today. Dr. Mozaffarian co-authored a landmark 2021 study about the eating habits of more than 60,000 Americans, of which 21,000 were children. He'll tell you plenty more about it, but one of the most compelling findings was the study's assertion that schools are now the single healthiest place Americans are eating. That is something that may surprise many people, but we are grateful for the rigor and thoroughness of this study and how it affirms what we and so many school nutrition teams are doing. Dr. Mozaffarian is a cardiologist, public health scientist, and director of the Food is Medicine Institute at Tufts University in Boston. He is Dean Emeritus and Jean Mayer Professor at the Friedman School of Nutrition Science and Policy, Professor of Medicine at Tufts School of Medicine, and attending physician in cardiology at Tufts Medical Center. He is a globally recognized leader in the science of nutrition, cardiometabolic diseases, policy, and food as medicine, aiming to create the evidence and translation for a food system that is nutritious, equitable, and sustainable. Doctor has authored nearly 600 scientific publications and is one of the top cited researchers in medicine. He has served on numerous advisory capacities, including currently serving on President Biden's Council on Sports, Fitness, and Nutrition. And his work has been featured in an array of media outlets. He is married, has 3 children, and actively trains as a 4th-degree black belt in Taekwondo. Please welcome Dr. Mozaffarian. Thank you so much, Doctor, for being with us here today.
Thank you so much. Thank you for letting me join you, and for the thank you too for all the work that you do for the 100,000 kids in the Unified School District that you're taking care of on so many days of the year. So I'm going to share my screen and talk about what's going on with food in the United States among children right now. Share my screen. So hopefully everybody can now see the screen. And so I think this is a really important question. You know, there's a lot of assumptions and notions around what kids are eating, but it's really good to look at the data and try to understand what's going on, and not only with what kids are eating, but where they're getting that food. And so I think we need to first just start and center ourselves. You know, why do we care about this? And there's a lot of reasons to care about food, but the top reason really, I think, is that people are really sick. We are overwhelmingly ill from our food today. And all of this has happened in my adult lifetime. This wasn't true 30 or 40 years ago. We have become incredibly sick from the modern food system. Today, many more American adults are sick than are healthy. 1 in 2 adults has diabetes or prediabetes. 3 in 4 have overweight or obesity. And less than 1 in 10 are actually metabolically healthy if you add blood pressure and blood cholesterol levels. So the vast majority of American adults are actually walking around sick, and many of them don't even realize that they're feeling sick, but they're sick because of our food. And this starts young, and so among American teenagers, kids, 13 and over, 1 in 4 kids has prediabetes. Like that, teens, that is just shocking. That is shocking. But 1 in 4 teenagers today has prediabetes. 1 in 4 has overweight or obesity, and 1 in 6 has non-alcoholic fatty liver disease. So it's truly an epidemic related to our food. And this is crushing our economy. And I think this is a really important message, because this isn't just about issues of food security and health equity. This is about dollars. And when you start talking about dollars, governments and the private sector start paying attention. And so our economy is being crushed by diet-related diseases. In 50 years, in my lifetime, we have gone from about 7% of all of our economy focused on healthcare to 18% of all of our economy focused on healthcare. So almost $1 in 5 that passes through everybody's pockets goes into healthcare. When I was born, only 5% of the federal budget was spent on healthcare. Now 30% of the federal budget is spent on healthcare. And so you look at all the arguments and all the problems that are going on in our state houses and nationally around budgets. And of course, there's partisan arguments and other things. But a big part of the fighting is that healthcare has swallowed up, the ability to spend on almost anything else. And if you actually look at the average cost of healthcare, today we're spending $12,000 per year per man, woman, and child in the United States on healthcare. So for an average family of 5, $48,000 a year we're spending on healthcare, more than the average family spends on food, housing, and transportation combined. So we are just swallowing up all of our free dollars in paying for healthcare. And 80% of this is spent on preventable chronic diseases. And as just one example, just diabetes, just the US government spending, the US government spends about $200 billion a year on direct medical costs for diabetes alone. And so as we argue about money for universal school meals or money for WIC or money for even SNAP, we're spending much more than all of that combined on just direct medical care for a condition like diabetes that's almost entirely preventable and curable with good food. And if you put all this together, this has been done by the Rockefeller Foundation. Today, our economy is losing about $2.1 trillion per year from our food system due to losses to human health and losses to our environment and biodiversity. About half of that is losses to human health, mostly chronic diseases. So we lose about $1 trillion a year from direct diet-related conditions. And then we lose about another $1 trillion per year from environmental and biodiversity losses. Now, our whole food system is about $1 trillion. So for every dollar we spend on food, we're losing $2. This is not a winning economic proposition. And of course, this is not happening equally across the country. People are challenged to getting healthy food. And this is not a map of healthy eating, but you could superimpose this on a map of healthy eating. This is a map of food insecurity, household food insecurity at any time over the past year. And you can see that household food security is very geographically different by income and education and race and ethnicity. And within each of these counties, it's also different by income and education, race, ethnicity. So there are significant disparities in food security. And these significant disparities in food security overlap almost perfectly with disparities in diet-related chronic diseases. This is the percentages of adults with diabetes in the United States. And you can see almost the same overlap because food insecurity is closely linked to poor nutrition and diet-related illness. So not only is poor nutrition killing and maiming us, and not only is it, destroying our economy, it's actually causing massive problems for health equity and disparities in our nation. Now, to address this, we need to address food security and we need to address nutrition security. And so this is a concept that we and others have proposed, and this is from a paper we published a couple of years ago with Sheila Fleischacker, who's now at USDA, and Chef Jose Andres, who leads Rural Central Kitchen. We published this a couple of years ago, pointing out that we've made a lot of progress thinking about food security, but unfortunately, the measures to test and screen and follow food security are all about calories and not really addressing nutrition. And so we have to, in addition to addressing food security, we also have to address nutrition security, which we defined as consistent access, availability, and affordability of foods and beverages that promote well-being and prevent, and even if needed, treat disease. And so this is supposed to be additive to be built on top of the concept of food security, so that it's not just about getting calories to people, but about getting nourishing food to people. And I've been very impressed with USDA Secretary Tom Vilsack, who has really served in many ways as the nation's chief nutrition officer. And he's talked a lot about nutrition security, even from his original Senate confirmation hearing. He said, our nation suffers from nutrition insecurity. We must do more to ensure access to the nutritious foods that can protect and promote health. And so it's not enough for school meals to address food security. They have to also address good nutrition. So when we define good nutrition, there's the U.S. dietary guidelines, which are put out every 5 years and have some strengths, but also have some limitations because the dietary guidelines tend not to want to say eat less of anything because they have an unfortunate inherent conflict of interest in that the USDA wants to, support U.S. food business and agriculture and provide dietary guidance. So the U.S. dietary guidelines love telling us what to eat more of and don't often say what we should be eating less of. And so this to me is my sort of summary of what we know about healthy eating and where I think we should really be moving. It's not just about eating everything in moderation. It's not just about eating plant-based. It's more complicated than that. There's foods basically to encourage, there's foods to be eaten in moderation, and there's foods to be minimized. At the top is the foods to be encouraged. These are what I call protective foods. This is what we need more of in our school meals, in our grocery stores, in our restaurants, in our home refrigerators and pantries. Most of the disease burden in the United States is from insufficient intake of healthy foods. So we need to have more fruits and nuts and fish and vegetables and plant oils and whole grains and beans and yogurt. These are very, very powerful foods that serve as biologic information with fermentable fibers that feed our gut microbiome, with tens of thousands of phenolics like flavanols and epicatechin and other nutrients that are in things like cocoa and beans and green tea. We really need to have more of these protective foods in our diet. This is a positive message, just a positive message for suppliers, for parents, for families, that we need to be eating more protective foods. Then there's foods to be eaten in moderation. You don't have to eat these foods. Adding or taking away isn't going to make a huge difference in the diet, but generally, they have modest effects overall on health. Foods like cheese and poultry and milk and eggs and butter and unprocessed red meats. Cheese is actually maybe higher on this list because as a fermented food, it provides significant unique nutrients like vitamin K2 or menaquinones. As a fermented food, cheese is pretty consistently linked to low risk of diabetes, which I think is quite interesting. And then milk also is associated with lower risk of high blood pressure and low risk of stroke in adults. It's associated with greater height in kids, so it has some modest health benefits. Poultry, eggs, butter are kind of pretty neutral, and unprocessed red meats are a little bit harmful, not because of the fat, not because of the saturated fat or because of the cholesterol, but because of the heme iron. Heme iron in red meats is highly oxidative. It damages the pancreas and it increases risk of diabetes. And so, lean or full fat meat, I don't think makes a big difference in health because it's probably the iron, too much iron, that's the problem when people have more than, let's say, a serving per week. Now, at the bottom are the foods that we really need to be minimizing and getting out of our school foods and out of our diets in general. processed grains, starches, sugars, processed meats, high sodium foods. And I think mostly people get this. They know that sugar is bad. They know that too much salt is bad. But what's been, I think, the hidden problem is starch, refined grain and starch. And that's still, unfortunately, I think, too high in school meals and in just the American diet in general. We've shown that refined grains, starches, and sugars is about 40% of all calories in the United States. So that's a lot. 40% of all of our calories come from refined starch and sugar, and most of that is starch, grains and starch, not sugar. And so refined grains and starches, I think, are a big problem, and really highly ultra processed foods, is the biggest supplier of these foods. So, to me, this isn't about eating everything in moderation. We want to be eating more of this and less of this. It's not about a plant-based diet because, yogurt and fish are up here. All of this, most of this is plant-based, the refined grains. So you could say minimally plant-based or whole food plant-based, that would be okay, but not just plant-based. It's not about just eliminating animal foods. You could eliminate animal foods and eat all terrible refined grains and starches and sugar. So it really has to be kind of a more holistic view of the diet. But I think that, this is where we're trying to go as a nation. So if you kind of look at trends in diet quality among US children over the last 20 years or so, here's what we showed when we published on this a few years ago. What this chart shows is the percentage of American kids, this is from 2 to 19, who have poor diet quality in yellow, intermediate dietary quality in gray, or ideal diet quality in blue. And diet quality here was defined using the American Heart Association diet score, which basically takes into account healthy food groups like fruits and vegetables and beans and whole grains and nuts and seeds and fish. And then it gives negative points to foods that we should be avoiding, like processed meats, high salt foods, and sugar sweetened beverages. And so it's a rough approximation of kind of the broad dietary guidelines. And ideal diet quality here is just pretty much kind of meeting the guidelines. It's not for across most of those things. It's not even all of those things. It's not an extremely good diet. It's just across all of those roughly 8 food groups meeting approximately the dietary guidelines. And you can see that almost no kids actually do that, less than 1% of kids, and that hasn't changed very much. So we should really focus on poor diet quality, which means kids who are really failing the grade, and intermediate diet quality, which is in between and still room to improve. The good news is that poor dietary quality is going down in the United States and intermediate diet quality is going up in the United States. So kids' diets are actually slowly getting better. They're still very, very far from ideal, but they're slowly getting better. And so in 2000, about 77% of kids had poor diet quality. And the most recent data from this paper, 2016, that had gone down to only 6% of kids having poor diet quality. And so you could look at that as an optimist and say that's a pretty big improvement. You could also look and say that more than half of all kids in the United States have poor diet quality. That's pretty bad. But let's see what has changed. What is really driving this slow improvement in diet quality? If we break it down, one of the biggest things that's happened is a reduction in sugar sweetened beverages, which has also led to a reduction in total added sugar. And so this has been a success in the United States among kids in the United States. Sugar sweetened beverages have gone down from about 2 servings per day on average for kids, down to about 1 serving per day on average for kids. So that's a huge improvement. And that's from kind of the public health messaging and understanding that sugar sweetened beverages are harmful. And because of that, total added sugar has gone down as well. Although if you look at added sugar in foods has not really gone down. It's added sugar in sugar sweetened beverages. And so this decline in sugar sweetened beverages is one of the biggest kind of wins over the last 20 years for kids' diets. On the other hand, intake of refined grains hasn't budged at all. And refined grains are, a starch, and starch is glucose. So, I don't think people think about that enough. Starch is 100% glucose. And so if you look at a bagel, or if you look at a piece of white bread, or look at a refined breakfast cereal, it's essentially 100% glucose. It's sugar into the bloodstream in the form of glucose. And so we really shouldn't be thinking about refined grains any differently as candy or sugar, because it's essentially the same. And that has not gone down at all in the United States. It's up over 6 servings per day. Whole grains are slowly going up, so that's good. But from a low of half a serving a day up to a serving per day. So they've doubled, And that also is part of the improvement that we see, but it's a pretty modest improvement. So these are two improvements: a little bit better whole grains, substantially lower sugar-sweetened beverages. The other kind of major improvement that's leading to higher diet scores is more whole fruit intake. And so 100% fruit juice is slowly trending down, and intake of whole fruits in the United States is slowly going up. You notice still we're not reaching even 1 serving per day. So we're still quite a bit off from where we want to be at 2 or 3 servings per day, but at least it's going up in the right direction. And vegetable intake, on the other hand, unfortunately, there's been almost no movement in vegetable intake over 20 years. So all our messaging, everything we're doing, eat your vegetables, all the stuff, it's low and remains low. The top vegetable is white potatoes in blue, and then other vegetables are much, much lower, and they haven't really increased at all over this period. And then if you look at animal foods, as I mentioned, minimally processed animal foods are mostly neutral, maybe a little bit of benefit for cheese, certainly benefit for yogurt. Not huge trends. There's some trends. Milk intake has gone down in the US over the last 10 years or so in kids, but cheese intake has gone up. And so that's probably offsetting that. And yogurt consumption is increasing, but it's really, really, really low among kids, much, much less than, 0.2 servings per day on average, so less than a serving per week on average. So still very, very low. And then meat intake, not a huge amount of trends. The main thing is this is poultry intake. Poultry intake has gone up. Unprocessed red meat intake hasn't changed very much. Processed meat is a big problem. Processed meat is bacon, sausage, salami, low-fat deli meats. Actually, still, I think too much of it in school meals, although it's getting better. Processed meats are carcinogenic, increased blood pressure, increased stroke, increased risk of diabetes, and that hasn't budged at all in the United States, and that I think is a problem. Now that I showed you the graph overall, that overall about 77% of kids had poor diets in 2000, and that went down to about 55%. But if you look by household income or by parental education or by other things, there's disparities in these improvements. And so this is the decline in a poor quality diet over this time period, but divided up into 4 groups by the ratio of family income to poverty level. And you can see that the green is the wealthier families with higher income to poverty level. They've seen the biggest improvement, down to now 47% of kids having low quality diets, whereas most other populations is still up around 2/3 of kids have low quality diets. So there's, I think, 2 take-home messages here is that all groups are improving, mostly because of the reduction in sugar-sweetened beverages, but wealthy families are improving more. And still, even today, this is not only a problem of poor families. Among wealthy families, half of kids have poor quality diets on average. So really, really still, very, very high rates of poor quality diets among kids. Now, what about looking at the food source? This is important because if we want to start to address this, we need to ask the question, where is the food coming from? And does the quality of that food, the nutritional quality of that food, vary by where it's coming from? And so the first question is, where do kids get their calories? And so this chart shows over about 15 years the trends in where kids get their calories through 2018. I'm sure this changed pretty dramatically during COVID with all the disruptions, but we don't have data, recent data from 2023, 2024. But I'm guessing it's kind of returned to this roughly stable proportion, which we saw before. And what we see is about 2/3 of all calories that kids get come from grocery stores, about 20% come from restaurants, about 8 or 9% come from other sources like entertainment venues or food trucks or food banks or other places, and about 9% come from schools. And I think it's important to highlight that it is really only about 9% of calories come from schools when you look at sort of year-round caloric intake. I have seen newspaper articles and people saying, oh, for some kids, half of their calories in a day comes from schools. I have not actually ever found good scientific data to support that phrase, which you see kind of written. I'm sure that there are individual kids that on a school day where they're having school breakfast and school lunch and school snacks are getting half their calories or more from school. But we have to remember that school is only 5 days a week, 180 days a year, and so half the days of the year kids aren't getting their meals in school for sure. And then most kids don't, even low-income kids, most kids don't eat school breakfast. many kids don't eat school lunch, they eat out. If they do, they don't eat it every day. And so even when we looked at this by race, by ethnicity, by income, by household income, by parental education, it was pretty consistent. Less than 10% of calories come from schools. And so I want to highlight that because first, it is important. I mean, roughly 1 in 10 calories come from schools, and schools can't be the only place that we improve kids' diets. And I think that there's a lot of pressure on schools to think about how do we improve kids' diets. And again, people are throwing around this number in their head that half of calories come from schools. Really, we got to be focusing number one on grocery stores and making sure that the healthy food is there and parents are able to get it and afford it and know what to do with it. And also especially restaurants, as I'll show you. So now what about the nutritional quality of the food from these different sources, looking at kids' diets in particular? And so what this graph shows you is the percentage of food that's being eaten by kids from these food sources that has poor nutritional quality. So higher numbers is worse. And again, this is based on the American Heart Association score. I mentioned to you lower fruits, vegetables, nuts, seeds, legumes, whole grains, and fish, higher sugar, sweetened beverages, processed meat, saturated fat, and salt. And so when we look at these graphs, there's some pretty striking findings. I should note, this is the actual food that kids are eating from these sources based on nationally representative data. This is not what's available. This is not the options they have to choose from and what's on the menu or what's in the grocery store. Or this is the actual food that the kids are eating. So it's really what they're getting. And so this is a combination of what's available, what they choose, and what they eat. So let's start with restaurants. So the take-home message, which I don't think we focus enough on, is that restaurants are really an awful place to eat in this country. Roughly 80% of all food consumed in restaurants by kids is of poor nutritional quality. And all you have to do is go look at any kids menu on a restaurant, but also look at what adults are ordering on the restaurant. And while there may be healthy options and salads and seafood and other things, people are going in and getting fries and refined grains and processed meats and not a lot of healthy foods, very little fruits and vegetables. Now, when we separated this by fast food restaurants versus full service restaurants, fast food restaurants were worse, but it wasn't that much worse. And so there wasn't a huge difference between fast food and full service restaurants on average. And so we really, really need to be thinking about the food that's served and the choices that consumers are making and kids are making when they go to restaurants. So that's the worst, and it hasn't improved. Now, then we look at grocery stores in blue. And grocery stores, the food that's consumed, that's purchased in grocery stores is slowly improving. It's gone down from about 55% being poor nutritional quality about 20 years ago to the most recent data, about 45% being poor nutritional quality. This improvement is a big part of why overall kids' diet has improved. And I sort of went through, why this is happening: less sugar sweetened beverages, more whole grains, a little bit more whole fruit. And so there is, this modest decline over time in grocery stores. On the flip side, if you look at other sources, which is about 8 or 9% of calories, you see that's getting worse. And this is food trucks and entertainment venues and other places that kids eat, cafeterias, not school cafeterias, outside. And that's gotten quite a bit worse, from about 40% poor nutritional quality to over 50%. Now let's look at kind of what we're here to talk about, which is schools. What happened in schools? And schools are in green. You can see from about 2003 to about 2010, 55 to 60% of all meals in schools was of poor nutritional quality. And this is the bad rap that I think when people think about school meals today, they're still thinking about, what was true until about 2010, that school meals on average were not a great place to get food. It was really pretty bad nutritional quality food through about 2010, or at least 55 to 60% of the meals were of poor nutritional quality. After 2010, you see a really, steep and substantial improvement in the nutritional quality of meals from schools, whereas by 2018, the most recent data available, only about 24% of all school meals were of poor nutritional quality. So, you could look at that in a few ways. Again, you could say, wow, 1 in 4 school meals still of poor nutritional quality. That's pretty bad, right? We have to continue to work on that and fix that. But on the other hand, as Alicia mentioned, today, schools are the healthiest overall place on average that kids eat by far in the United States. And if you overlay adults on this, obviously adults don't have schools, adults have restaurants, other sources, groceries, and workplace cafeterias. That all looks like these red, yellow, and blue lines. And so among all Americans, kids and adults, schools are the overall healthiest place on average that people are eating today. So what happened in 2010? Most of you probably know what happened in 2010 is Congress passed the Healthy Hunger Free Kids Act, which substantially improved the nutrition standards for school meals. And that single policy change, one law passed by Congress, dramatically improved the quality of food for millions and millions and millions of American kids. And so I think about it, I look at this graph and when we publish this, and this just brings me back again and again to the power of policy, the power of state policy, the power of federal policy. Everything else we've been doing to try to get Americans to eat healthier, everything else, dietary guidelines, going to your doctor, social media, education campaigns, community campaigns, CDC campaigns, everything else we're doing, trying to get people to eat healthier, can be reflected in the red line, the yellow line, and the blue line, right? That's the whole rest of the food system. Everything, food companies trying to manufacture healthier products, consumers thinking about what they're eating. And you can see, not great improvement over 20 years. Over 20 years, restaurants, pretty bad, maybe a little bit better. Grocery stores, yes, noticeably better, but still not great. Other sources actually worse. So every other thing we've done over 20 years has led to pretty modest and kind of mixed and opposing changes. Whereas one law passed by Congress with strong nutritional standards dramatically changed food quality. So this really brings me back to the power of policy and not just focusing on behavior change in education, working with industry, dietary guidelines, all the stuff that we really love to talk about. But if you look at what it's really done, it's very little, very, very little movement when we put all those things together. So we have to be pragmatic and come to the world with eyes wide open and see the policy change, nutrition standards. That's what really changes nutrition. Now, I showed you disparities. I showed you disparities in overall improvement in food. I want to show you a little bit more on that. And so what this is looking at is the change in nutritional quality of foods consumed from grocery stores by household income. And children are at the top and adults are at the bottom. Now, these graphs are a little bit confusing because they show ideal diet quality, intermediate diet quality, and poor diet quality all in the same graph. And so it's a little bit confusing. But if you just look at the blue lines are what we've been talking about this whole time, which is the percentage of people with poor nutritional quality. Intermediate quality is down here, very, very low. The orange ideal is down here. Orange is the intermediate diet quality. But let's just focus on the blue lines. The percentage of kids and adults, the food they eat from grocery stores, is it of poor nutritional quality? If you look at high-income households, with a poverty income ratio 3.5 or higher, you can see kind of what we saw the overall graph. Over time, over these 20 years, the percentage of food consumed from grocery stores that's of poor nutritional quality is going down, and it's being replaced by food of intermediate nutritional quality. So there is improvement, and you see this in kids, you see this in adults. In adults, if you look at middle income or low income, you see progressively less improvement, but still some improvement. So even low income adults, there's a slow improvement in slow decline in proportion of food of poor nutritional quality. Middle income, there's a decline, but the steepest decline is here. So in adults, you see disparities by income, but there's still improvement. In kids, you see almost no improvement in the lower two income groups. And so if you look at the blue line, it's pretty flat for both middle income groups. So everything I told you about improvements in the food from grocery stores, like we go back here and we see this kind of slow, improvement in food from grocery stores, it's all being seen in the upper income kids, and lower income kids are not seeing that at all. So there's significant disparities. And if we look at nutritional intake of food from restaurants, we see the same thing, pretty significant disparities. Now, what about schools? I showed you this dramatic improvement in nutritional quality from schools. What about disparities? What's really striking, what's really incredible to me is that there are no disparities in this improvement. You see this improvement consistently by race, by household income, by parental education. And here's the graph showing it at the top by race and at the bottom by income. But as I said, you could also look at education and other things. And you see this improvement in all groups. And so here we have the proportion of food of poor nutritional quality from schools. Again, blue is what we're looking at. and you look at non-Hispanic whites, non-Hispanic blacks, and Hispanics, and you see very consistent, very steep declines in food of poor nutritional quality with corresponding increases of food of intermediate diet quality in all three racial ethnic groups with really no differences. And even by household income, no differences at all. Low-income kids benefiting just as much as middle-income and high-income kids. And so again, it brings me back to the power of policy. A single policy change dramatically improved nutrition and did so equitably, compared to, if you go back, all the other stuff we're doing, everything else practically we've done to try to get people to eat healthier, there's very small improvements and there's disparities in those improvements. So I think this is a really important finding, thinking about the power of schools and strong nutrition standards in schools. Now let's just go through a couple of other ways of looking at the kids' nutritional quality. I sort of showed you sort of food groups, put together fruits and vegetables and other things, but we know beyond food groups, there's also this concern about junk food and ultra-processed food. So what are the trends and what are the disparities in these foods among kids? And so this is a paper we published looking at trends in junk food intake defined as snack bars, candy, savory snacks, crackers, desserts, and sweet bakery products. And you can see there hasn't been much improvement in junk food intake in the United States. And so while there's been a decline in sugar-sweet beverage intake and higher whole grain intake, and a slight increase in whole fruit intake that I showed you, there's been almost no improvement in junk food intake, with about 18%, 18% of calories, almost 1 in 5 calories among kids coming from junk food. And you can see that the biggest category is sweet bakery products in blue. The next biggest category is savory snacks. And so it's really bakery products and savory snacks that are the biggest problem. And if you look at the sources, 73% of this comes from grocery stores, 8% from restaurants, 5% from schools, and then 13% from other sources. And if you remember, schools are about 9% of calories, but only 5% of the source of junk food. So that means that schools, on average, have much less junk food compared to other places. And so again, it's a positive sign. Most of it's coming from grocery stores. And so if we want to address junk food intake, we really have to go back to what's being purchased in the grocery store and what's being consumed in the home. And what's quite interesting is if you look at junk food intake and trends over time by race and by socioeconomic status, you don't see the predicted disparities that you see for kind of food groups. This is actually kind of a surprise. And so here, the lowest junk food intake by race ethnicity is actually among Mexican American kids, who are probably, this is probably closely related to acculturation and kind of, more traditional foods and less junk foods. And actually, non-Hispanic whites have the highest intake or slightly similar intake to non-Hispanic blacks when it comes to junk food. And if you look by education, it's actually the opposite of what you'd expect. Families with some college or above have higher junk food intake than high school graduates in high school. And that may be because of the cost, because these foods cost a lot of money. Junk food's actually kind of expensive when you buy these foods. And so maybe because of cost or other things. But we published, faculty from Tufts published on this, and others have published on this, that if you look at foods, this is from all sources, not just in schools, but if you look in schools, foods brought from home on average today have worse nutritional quality than foods sold in schools. And so a lot of junk food is being put in our kids' diets, and it doesn't have the traditional kind of race, ethnicity, education, income disparities that you might expect, with white and higher educated people actually consuming more junk food. And if you look at ultra-processed foods, I said junk food is kind of stable, but ultra-processed foods are all ultra-processed foods. And so this includes particularly highly refined grains and starches. That's going up in this country, unfortunately. And so, you look here, this is the trends in ultra-processed food intake among kids from 2000 to 2018, and it's gone from about 60% of calories to 67% of calories now consumed. So 2/3 of calories consumed by kids today are from ultra-processed foods. And so people say, well, why isn't health getting better when I showed that dietary trends are slowly improving? It's not getting better because junk food and ultra-processed foods are not improving, in some ways getting worse. And if you look at what are the drivers of this higher intake, this is a graph showing all the different categories of ultra-processed foods. And the blue circles are the most recent data from 2018. The orange is the older data. And so anything moving this way means increases. Anything moving this way means decreases. And so, as I said, as I've showed you before, sugar-sweetened beverages have gone substantially down. And so as a percentage of all of ultra-processed foods, it's gone from about 12% of all ultra-processed foods to about 5% of all ultra-processed foods. So this is the big win in the United States, is sugar-sweetened beverages have gone down, mostly due to lower sugar-sweetened and diet soft drinks. Fruit drinks, sweetened, not 100% juice, but fruit drinks and other sweetened drinks are going up. So that's a problem, but really sugar-sweetened beverages have gone down. So that's a win. And then that's offset by other stuff. So much higher, dramatic increase in ready to heat and ready to eat mixed dishes, pizzas, sandwiches, hamburgers, others. And so, Americans are turning more and more to convenient, quick, fast solutions, ready to eat. That's the biggest increase. And then also sweet bakery products have substantially increased. And so a lot more sweet bakery products in the United States. So those are the two big increases and big problems when we look at ultra processed food. Now, like I showed you for junk food, the disparities are not what you'd expect. And so this is looking at the percentage of calories from ultra processed foods over time by race and by family income in US kids. And as before, Mexican American kids have the best or lowest intakes of ultra processed foods, although it is substantially increasing. And non-Hispanic white and non-Hispanic black are kind of overlapping, maybe a little bit worse for non-Hispanic blacks, but not that dramatically different. And no relationship at all by income. And so all households are being inundated, regardless of their income, with ultra processed foods. Really no major substantial differences. So if we want to kind of sum it up, I think the big picture findings since 1999, overall diet quality, if you look at foods and nutrients, has slowly improved. Poor diet as a whole has gone down from about 77% of kids to 56% of kids. Although, as I showed you, there's disparities in this by race and education income. It's mostly due to increased fruits, a little bit of increased whole grains, a little bit of increased yogurt, and decreased sugar-sweetened beverages, but we're still quite a bit away from an ideal diet. More than half of kids still have a poor diet. And as I mentioned, there's major remaining disparities by race, income, and education. If you look by food source, by where the kids are getting the food from, there's been very little improvement in food from restaurants, modest improvement in food from grocery stores, and worsening from other sources with disparities in these. But in contrast, huge improvements from schools and equitably all after the Healthy Hunger Free Kids Act. Junk food is nearly 1 in 5 calories and not really going down. And ultra processed foods are going up, now 2 in 3 calories in US kids. Grocery stores are the major source, and intakes are highest among whites and non-Hispanic blacks and lowest in Hispanics, with little differences by income or education. And so when we look ahead to the new USDA proposed nutrition standards, I think these are unbelievably important to pass and to move forward on, to continue to improve school lunch. These are very modest changes that have been proposed. And I know there's challenges to procurement. I know there's challenges to preparation. I know there's challenges to cost, but it's absolutely essential that all schools really strongly support these and all Americans strongly support these. Modest improvements in added sugars, including some limits on added sugars in flavored milk, more whole grains, and especially less sodium. Now, Congress is getting involved, as you may have heard. So this is a proposed rule by USDA. Those in the food service know this really well. Those of you who are not in the school food service might not know this. This is a new proposed rule. It's not been finalized, and there's time for public comment and so on. But Congress is also getting involved. And so Congress there's 2 things that have been proposed, not yet passed and signed into law. One is Congress has recently proposed a whole milk rider, allowing whole milk back into schools. I actually think this is a good idea, so I don't think we should not have whole milk in schools. There's not a lot of evidence that whole milk is worse for kids than skim milk. And actually, I think if we can get kids to drink whole milk, plain whole milk, rather than sweetened skim milk, I think that's a win. I don't like that this rider also includes sweetened milk. I think it should just be whole plain milk. But there's still, of course, the question of should Congress be mucking about in this at all, or should it just leave it to USDA? And so I think this is an interesting thing that's really happening, and it passed the House, to my knowledge, and it hasn't yet passed the Senate to let whole milk back into schools. And then Congress has also proposed, but I don't think has passed both houses, to exclude cheese from the sodium limits, and that's going to create a lot of confusion and problems with implementation if people have to sort of figure out and exclude cheese when they're looking at sodium intakes. And so Congress is as interested in nutrition, but this is sort of an uncertain area now. What's going to happen with the USDA proposed rules and with Congress and so on moving together? But I think it's really, really important. And so when you look at how we're going to fix food in the country, we sort of have, I think, 6 domains of action, and we've written a task force report on this. We need to integrate food into healthcare systems. We need to advance our government nutrition programs. We need to advance science and research, do more public health and education on nutrition, promote business innovation, and really reward businesses that are doing the right thing, and actually have a national coordinated plan. And of course, today we focused on government nutrition programs and in particular school meals. So really happy to be able to present it with you and look forward to time for questions.
Fantastic. Thank you so much. The questions are coming in, and Dr. Mozaffarian, question: did the study have any insights as to school food sourcing, where schools are getting their food, as an indicator of the improved nutritional quality?
Yeah, that's a really good question. So we used nationally representative data from NHANES, the National Health and Nutrition Examination Survey. It was asking about what people actually ate, not what was served. And so we don't know the sourcing. We just know what people were actually eating. There is evidence that the sourcing of foods does make modest but measurable differences in the nutrition. And so if you source foods from more local sources or more regenerative agriculture sources or more organic sources, you're going to get lower pesticides, more nutrients. I don't know quantitatively how big of a difference that makes versus the food itself. So for example, if a kid's eating a peach, is it that much more important that it's a local regeneratively grown organic peach versus a peach from shipped across the world from South America? I'm sure the local regenerative grown peach is healthier, but how much healthier, right? 5%, 10%, 15%. So I think both are important. I think sourcing is important, but I also don't want to throw the baby out with the bathwater and just say that we should only source foods from local sources, because there are some supply chain issues right now.
Thank you. And to follow up on that question, Melanie, if you could comment on where the food being served to our children is being sourced here at San Diego Unified.
And you guys are lucky in California, being in California, you've got a lot of choices. Yeah.
We are very, very
Yes, we are very, very lucky here in California, because of much of what we do, we focus on California food for California kids here at San Diego Unified. So we do try to source as much local fresh food as possible, and that's not just produce. We do a lot of locally freshly sourced produce. We have a harvest of the month every Wednesday on our salad bars. And that typically is locally sourced produce. This month we have golden nugget tangerines from a farm up in Valley Center, but also our dairy. So Hollandia Dairy is where all our milk comes from, which is in San Marcos. Mary's Chicken, which comes from Fresno, up in the Central Valley. Think Whole Foods if you know Mary's Chicken. And then our bakery for all of our bread is just from a bakery up the freeway in LA. So we do really try to source, California food for California kids. It's a win-win too, because it doesn't travel as far, so it's better on the environment. And to date, we've sourced about 140 tons of local fresh produce, which is wild to me, but it's a lot of produce. So.
Yeah, and I just put in the chat, like, we shouldn't forget taste, because if for anyone who's ever left the United States and gone to Italy or gone to Asia or gone anywhere where they're actually getting their fruits and vegetables from local sources, or they're picked ripe and served ripe, as opposed to being shipped for a week or two in a boat and ripening on the boat, the taste is so different. I mean, it's really hard in most of the country. You're probably, again, luckier in California to find a tomato that has any taste, or to find a peach that has any taste. They look beautiful. They're shiny, they're glossy, they're big, and they're completely bland. And so, we've kind of engineered the taste out of a lot of our food with sort of mass production. And so I think that the local sourcing is probably really important, just because it'll taste good and kids will really like it.
Yeah, I agree. Yeah, we have strawberries right now from a local farm in Hamul, and the students have been raving about how sweet and juicy they are, and they look really beautiful. They're just bright red and very popular.
Thank you. Another question from the Q&A. How can school districts incorporate culturally diverse, healthy foods into school meal options?
Well, boy, I'm not an expert on that. So you guys are the expert on that, Alicia and Melanie. So, I think it's obviously important. And, when school districts are doing things at scale with ridiculously low reimbursement, with some schools, I don't know what it's like in your school district, but around the country, some schools having a microwave and a can opener as their entire, equipment profile, I think it's very difficult. So I think it's a balance, right? To do your best with what you have. I think nutrition has to be, a top priority. Not losing money has to be a top priority.
Mhm.
And then, so I think that has to be something that can unfortunately yet be a top priority. But if we started investing more in school meals, we started looking at some of these externalities and paying more for reimbursement, I bet we could do more. But I'll let Melanie comment on that. I think it's quite a challenge.
Yeah, it is a challenge, but I mean, it is important to us here in San Diego too, because it is a culturally diverse population. So, and we're kind of the hub of taco stands and Mexican food. So we do have, tacos, burritos. We have a Mexican bean bowl, and then we have Asian chicken, vegetable pot stickers on our lunch menus this school year. And again, a lot of it is things that we can scratch cook. So, the beef that is in our tacos and burritos is freshly prepared in the school cafeterias, seasoned. They're in the cafeterias too. So it's not even a pre-made seasoning we're buying. It's actually a seasoning that our chefs have put together, and they have these seasoning kits in the cafeterias to season the meat. That helps cut down on the sodium. And then we have actually vegan pot stickers on the menu this year that are tofu, cabbage, and carrots. And then Asian chicken with whole grain rice. So, we really try to keep those menus as diverse as we can. We obviously need the students to also enjoy them and want to eat them. So there is a balancing act there, but the students seem
Melanie,
to be very happy.
are you concerned about the USDA proposed rules being too difficult, or with the phase in and kind of the modest changes, do you think they're doable?
I think they're doable. I worry a little bit about the sodium, but it's in this industry, the manufacturers that we work with, the K-12 manufacturers, they are very aware. They pay attention to those regulations and are constantly modifying their products to meet the guidelines because they need to sell to the K-12. So I don't overly worry about it. I feel like a lot of times too, it's a gradual adjustment. It's not something we have to implement like the next school year. They give us time to adjust to the new requirements, so we can work our way towards those goals.
That's great to hear. Again, your boots on the ground, and so you see it. But I will say that when the 2010 Healthy Hunger Free Kids Act was being debated, school, lots of school district food service supervisors came to DC and said this can't work. Food service providers, big vendors like Aramark and Cisco, they came and said this can't work. We're not going to be able to do this. It's going to destroy school meals. Well, they passed the law and it worked. Like people figured it out, and so I think that Congress today is finding and bringing people who are opposed to it, bringing folks from schools like yourself who are saying this can't work. It's impossible. We can't do this. And so I think voices of school districts that say, yeah, we can do it. It's not going to be easy, but we're used to making magic out of nothing. We can figure it out. It's important for the kids. I think Congress needs to hear that. So I think that's great.
If I may, you mentioned some important things to share with our stakeholders here in California. The state has prioritized our students with universal meals here in California, and they prioritized the return to the basics of scratch cooking in our cafeterias with grant funding to get us the equipment that we need and the reimbursement that we need to provide better meals to our kids. And so for our stakeholders, please be aware that we are working very hard to return back to the days of old, when we did much more scratch cooking, and we're educating a workforce that is being taught how to cook again. And so that's something that we should be cognizant of as we rally for change. All right, let's see. Do we have time for one more question, Doctor?
I think so, yeah.
Okay, great. Have you seen a significant change in the last 8 years from the charts, or has it remained near the results in 2016? And then second part, have the trends continued to move in the directions depicted?
Yeah, so some of the analyses were through 2018. So and definitely through 2018, the results were the same. NHANES got disrupted by COVID, and so 2019 and 2020 weren't completed and were sort of combined. I haven't seen any big differences looking at through 2020. There aren't really any good nationally representative data after 2020 on what people are actually eating, and the CDC wasn't able to collect the usual NHANES cycle of information during COVID. And so we're not going to know, we don't know, and we're not going to know probably until the 25, 26 data are released, which won't be till 27, 28. So we're kind of in a data-free zone for the next 3 or 4 years. I don't think we're going to get any new national data. It's very hard to collect these data. You need to do repeated 24-hour recalls and do it carefully and sample people. So I'm guessing that on average, trends have not changed very much. That they've continued in these directions, but with all the disruption of COVID, but now coming back to normal. But it's very hard to say.
Thank you. All right. Well, that's been such an informative hour. Thank you all for coming and for your care and concern for our children's nutrition. Know that the San Diego Unified Food Services Program looks forward to engaging our stakeholders in the future with more events like this. And so please look forward to some additional information after the engagement today. Dr. Mozaffarian, thank you so very much for sharing an hour of your day with us. It has been extraordinary having you, and we wish you the very best. Thank you all for joining us.
Yeah, thank you. Thank you so much for all the work.
All right.